we get started, I'd like to read this brief disclaimer that you see on your screen. The PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by your provider. And with that out of the way, I'd like to thank you and welcome you again to the PharmAssist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your very own home. PharmAssist takes place every Monday evening at 7 p.m. Eastern Standard. Tonight, we will be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A question and answer section throughout the program. We are joined by various amazing HCPs each week from across the nation to provide you with the real-world experience, just as if you were sitting across the table from them in the clinic. Today, we are joined by Laurel Meier. So thank you very much, Laurel. I appreciate it. Thank you for joining us tonight. And for all of you out there, you can join us via Zoom or Facebook Live. We invite you to be a part of the discussion by sharing your questions live in either format. We will get to those in a bit. But in the meantime, thank you so much for your time and interest this evening. And I would now love to turn it over to Laurel Meier.
Hi, everyone. My name is Laurel Meier, and we're going to be going over 3 medications, the Manipur, the Senara Patch, and the Ava Drill. We're going to do question and answer session after each video. So I encourage you to put in any questions in the chat box that you have questions on, because I know they're going to help others as well as yourself. So please focus your questions on how the medication is drawn up and given, how it's mixed, and what are the potential side effects. If you want to know what its purpose in the body, why it's being used, those are awesome questions. But if you have specific personal questions about your own dosing, please direct those to the clinic. Now, these videos, including tonight's, are going to be available at mymandelsPharmacy.com. You can view them at any time. So what I'd like to do now is to share a story on how I became interested in becoming an IVF case manager. About 25 years ago, my husband and I started having problems getting pregnant. And we started by doing several rounds of Clomid without success. After that, we decided to invest in IVF, and we did 2 rounds of IVF. Unfortunately, those were also without success. However, we knew we wanted to adopt if the IVF didn't work, and we had been open with our friends and family about that decision. And as we were still reeling from the bad news of the last IVF procedure, a friend who was a labor and delivery nurse gave me a call. She said that a woman had just delivered a baby on her unit and wanted to adopt out. And she had told this woman about my husband and I, and she was interested in meeting us. So we went to the hospital and we met her and her new baby. And after talking, she decided that she wanted us to be her baby's parents. So we brought our little baby home from the hospital, and it was Valentine's Day. So that was a special day for us. Then 4 years later, we were the recipients of a donated embryo. The embryo had been created by a couple who had gone through infertility and had extra embryos that they donated to the clinic. And we were the happy and grateful recipient of this embryo. It was transferred to my uterus, and I had a successful pregnancy and had a little baby 9 months later, happened to be born on 4th of July. So I've got 2 holiday babies, and they're now 16 and 20, and I'd like to show you a picture of them. Here they are. This is Megan and Sydney, all grown up. So the reason I tell this story is because I know personally how difficult this process is. And I know you're going through a hard time. You wish you were already pregnant. It's difficult to not know how the story is going to unfold. But this is a very stressful time, and it's what got me interested in wanting to become an IVF case manager and wanting to invest my time and knowledge in the PharmAssist program through my Mandel's pharmacy. It's a wonderful program, and I'm proud to be a part of it. And my goal is to help you decrease your anxiety by increasing your knowledge and your confidence in giving your shots. So that's my goal tonight, is to help you gain confidence with your shots. So as I said, we're going to be going over Manipur, the Senara Patch, and the Ava Drill. And there'll be question and answer after every video. So we're going to start now. Craig, can you run the first video on Manipur? Hi, my name is Laurel, and today I'm going to demonstrate how to mix and give the Manipur. Manipur comes in little powders, and we're going to use our imagination, and we're going to pretend that there's little white discs of powders in these vials. You'll also need a container of saline, a Q-cap, which is a needleless mixing device, a 3 ml syringe, and a small needle for giving. So make sure you have all your supplies ready. And the first thing you're going to do is take the caps off of your supplies. Now, some clinics are going to order for you 1 vial of Manipur. Others will give you 2 or 3. So just follow your clinic's instructions on how many vials of Manipur. Each vial is 75 units of medication. So if you're told to give 150 units, that would be 2 powders. You're always going to be able to mix this Manipur and give it as 1 shot. So the next thing we're going to do is to peel that off. The Q-cap will go directly on the liquid. Just pop it on and take the plastic covering off so it looks like this. Then you're going to take your 3 ml syringe and you're going to put 1 milliliter of air in the syringe, and you're going to twist it onto the Q-cap. Now, keeping it on a hard surface, you're going to push the air in and invert it. Draw up 1 milliliter of the liquid. So you go a little past the 1 and you push the air out until you're right on 1. Pull off your liquid and put it to the side. Now we're going to pretend to mix the powder. So here's the first powder. You push the Q-cap on, you inject the liquid into the powder, and you swirl it very gently. This powder will instantly dissolve. Now, if you have a second powder that you need to dissolve, you're going to push the air in while it's inverted, pull everything back into the syringe, take the empty vial off, put it to the side, and then do the same thing with the second powder. Push it on, inject this into the powder. It will dissolve immediately. Swirl a little, turn it upside down, push, and pull all the liquid back into your syringe. Now, when you're done with all of the powders that you've been told to inject, you're going to twist everything off while you're still pointing your syringe at the ceiling. And you're going to take your small needle and you're going to add the needle. The needle goes on like this. Twist it on, pull the cap straight off. And now it's time to get rid of that air. So just push until you see a drip of liquid at the tip. And you're ready to give your shot. So this is given in the abdomen. Pick a spot, stay an inch away from the belly button. Don't inject into a spot that has a bruise from a previous shot. Anywhere you can pinch some fatty tissue, just give it a pinch, inject straight in at a 90-degree angle, let go of the pinch, inject your medication, wait 3 seconds, grab a Kleenex, pull out and hold with the Kleenex. After about 10 seconds, check your skin site. If it's dry, no bleeding, you're done. If it's bleeding a little medicine's leaking out, Just keep holding it until it's dry. Everything goes in the sharps container, and your next shot, you're going to get a whole new supply. That's all there is to it. All right, so that was Manipur. Are there any questions about it?
Absolutely. All right. So we have our first question here that says, does the amount of liquid that I mix with the Menopur impact the shot at all? Specifically, how much or little it causes discomfort? Does adding more or less help? Anything would be helpful. Thank you.
Sure, yeah. Menopur can be given with, well, we recommend that it's given with 1 milliliter of the saline. If you are giving up to 4 vials of the Menopur at a time, so 1 milliliter is good. Technically, you can give up to 2 milliliters of solution into the subcutaneous fat, but I think using more liquid is just going to make it hurt more, so I don't recommend that. If you're only giving 1 vial, 1 powder of the Menopur, you can use 1/2 of a milliliter if you'd prefer. However, the trick to this not stinging, and this medication does tend to sting a little bit more than the others, the trick to stopping that sting is to give this medication as slowly as you can. Very slow.
Perfect. Thank you so much for sharing those tips on how to make sure that we can minimize some of the discomfort. Again, remember everybody, the entire purpose of this is to make you feel like a pro by the end of all this. So any questions about anything, how it works, what it does, anything on how to make it, maybe ease some potential anxiety that you have, that's what we're here for tonight. So speaking of which, this question just came in that says, what is Menopur exactly and how does it work? Do I use it with other gonadotropins or should it be used alone?
So Menopur is a combination of follicle stimulating hormone, FSH, we call it, and luteinizing hormone, or LH. And this medication works to stimulate the ovaries to produce multiple eggs. And it is given either alone. Typically, it's given alone when you're going through preparation for an intrauterine insemination. And if you're going through an egg retrieval process, an IVF cycle, it's typically given with a purified FSH, either Gonal-F or Follistim. The reason why they give it in combination with a medication that's only FSH is that you don't really need a lot of LH. And Menopur has that LH in it. You do need it, but you don't need a lot of it. You do need a lot of FSH, however. So you're going to get it. You're going to be given a dose of the FSH and a dose of the FSH-LH combination as well.
Perfect. Thank you so much. I think those are a lot of times, and you've noticed a lot, Laurel, that we do get questions not only on worried about the actual injection itself, but also understanding how the products work. And so that was a great answer to really help people understand what the process is, not just, we all know the end result of where we want to get, but it's great to also know how we're going to get there and what the journey is. And so that's a lot of, where these questions come into play. So any follow-up questions that you think of, and one quick reminder, you can ask any of your questions. If you're on Zoom, you can ask it in the Q&A or in the chat section. And then obviously, if you're in Facebook Live, you can just go ahead and put your questions right into the chat there, and we will get to them, such as this question that says, why does this medication cause heavy bloating?
Yes. So the FSH in Menopur is stimulating the antral follicles to develop. They start out really small, but they get to be the size of grapes. So if you can imagine a small cluster of grapes, that's what your ovaries look like once they've gotten to the full mature state, and that those ovaries get a little heavy. And so it really does cause some bloating and some discomfort. It can even feel like you're carrying a couple of rocks around in your pelvis, one on each side, because your ovaries are swollen and they are pulling on the ligament that is holding them in place. So you feel that in your pelvis. You get that bloating sensation. You have to wear your loose pants. It's very common and to be expected to have some bloating with this medication.
Thank you very much. And it's great to hear about the that it's the loose pants is something that makes people feel a little bit comfortable to try to get through some of this stuff day to day, right? The other options, not just the taking the medication itself, but how can you ease some of those potential discomforts? And so that was very, very helpful tip. So thank you very much, Laurel. So I know you talked a little bit about this in the recording itself when you walk through the product, but we get this question a lot, and it's this person types in, it says, I'm not exactly sure why I'm getting a Q-cap. How exactly does it work, or why can't I just mix it with the needle alone?
Okay, so a Q-cap is a needleless mixing device, and I'll show you here. It has this little thing to puncture through into the vials, but you can't hurt yourself with it. It's very, very safe. So it's recommended to use the Q-cap to do the mixing because of that. You're not going to hurt yourself. But some people do feel like they just want to use the needle because maybe they're used to it for some reason. If you do want to use a needle to mix it, you can. And I would just request from your clinic the supplies for that if you feel strongly about it. If for some reason you didn't get the Q-cap with your shipment, please call Mandel's. They'll set you right up with a batch of Q-caps.
Great, and it's just a reminder again that part of the trinity of treatment here is not just you, the patient, and your HCPs, but also us at the pharmacy, and Mandel's is here to help you with these things when you have these types of questions, or when you do need assistance with these types of situations. Always reach out to Mandel's directly, and we can walk you through any of these types of questions that you may have. So thank you so much, Laurel, for bringing that up. As of right now, I just want to say that we've caught up on all the questions, but we will also give you a few more seconds. We'll give another 30 seconds or so if you're trying to get a question out there. And just as a quick reminder, if we move on to the next product, you can still ask questions, and you'll have a chance at the end to ask questions about all three products. So don't feel like you have to rush. But in the meantime, Laurel, as we're giving people some time, I will throw it back over to you in case there's anything you'd like to share, and then we'll recap, see if there's any more questions.
Okay. Yeah, I'd like to talk a little bit about the side effects of Manipur. As I said, it does tend to sting a little bit. Give it very slow. If you want to try to ease that stinging, there's some good products to do that. We're going to be talking next about the Senara Patch, which is a really great product to numb the skin. You can also ice your skin site for 30 to 60 seconds prior to the shot, and that's going to help. Well, you may have some redness at the site. You may have some bruising. That is to be expected. I wouldn't worry about it. The bruise should resolve within like 5 to 7 days. But I would recommend do not give an injection into a bruise from a previous shot. So please remember not to do that. Just pick a site on the belly, stay an inch away from the belly button, and just rotate around to a different site each time. Side effects, we talked about the bloating because someone had a question about that. Other side effects you might experience would be some emotional ups and downs that you wouldn't normally expect. And you could have some ovarian hyperstimulation, some mild ovarian hyperstimulation, which is just that the bloating gets a little bit bad, and it can cause a little bit of nausea sometimes, and can even cause a little bit of shortness of breath. But if you do get anything severe like that, please call your healthcare provider. Any other questions?
Thank you very much. Yeah, one that just came in. So we tend a lot to try to stay away from too specific questions, obviously, because always refer back to your HCP on their actual guidelines and how they want to do things. But this is more of a little bit specific to an individual patient. And it says there was a situation where they had a number of eggs that came out, or embryos that came out after their treatment, and they wanted to know what are the chances of, like in this case, if you have 15 different eggs, what are the chances of which ones would be good embryos, and what's a good way to find that out? Not that we're going to be able to tell them exactly what number would, right? Because we don't know. But what's a good way to find that out? What should they be asking? What questions should they want to know to get a good idea on what the outcomes might be based on the number of eggs that they had, after their treatment?
Okay. Yeah, that's a complicated question. But there are some sources for you. If you go to SART.org, which is Society of Artificial Reproductive Technologies, SART.org, they have statistics based on success rates for age groups. And really your age is more important than the number of embryos that you get. So that's one thing you can do. You can look at specific clinics and their success rate. And that helps you choose a clinic if you're still in that choosing process. Another thing to remember is that there's always the option of testing your embryos genetically prior to transfer. This is called PGS. It's not something I thought I'd be talking about tonight, but I'm happy to. Pre-genetic screening is a test where a few cells are removed from the outer trophectoderm layer, or the outer cell layer of the embryo, and those cells are frozen separately from the embryos. The cells are sent off to the genetics lab for testing, and the embryos are frozen and kept at your clinic. And then about a week to 2 weeks later, you'll get those results. And then you know for sure which of those embryos are the healthy genetic ones. It doesn't mean 100% that you're going to get pregnant with one of those euploid or normal embryos, but it's a much higher chance because you know that you're transferring only normal embryos.
Thank you very much. No, that's an excellent answer, and I know we don't want to go too deep down that rabbit hole, just because those are things that it's a little bit outside of the scope of what we're talking about tonight. But it is a great opportunity for you to recognize maybe some sources out there and some questions that maybe when you do go back and talk with your HCP, you can reach out and talk to them about some of these different sources and different opportunities that you may have, which we always recommend. When you have very specific medical questions, we cannot stress enough to make sure you go back and talk with your HCP to make sure that you follow their best recommendation. You're seeing them for a reason. You feel comfortable with them for a reason, and we want to make sure that you're going back to them with those types of questions. But awesome answer, Laurel. Thank you so much. Mm-hmm. And with that being said, we are all caught up on our questions right now. So if you want, you can introduce and move on for the next video.
Okay. All right. So the next video we're going to show is on the Senara Patch. This is a wonderful medicated patch that numbs the skin so you don't feel your shot at all. So go ahead and cue up the video when it's ready, Craig. Hi, my name is Laurel, and today I'm going to show you how to use the Senara Patch. The Senara Patch is used to numb the site before you give an injection. It can also be used for an IV start. It can be used for a lab draw. So whatever you need for it numbs the skin. So what you're going to do is you're going to open up your package and pull out your patch. It's a combination of lidocaine and tetracaine. It is activated by heat, and it gets the medication into your skin using the heat. So what you're going to do is pull this back. The medication is in the middle, so you don't want to touch that part. You want to make sure that the place where you're putting the patch for your injection is clean and dry. And then you're going to place that right on the area where you want to give your shot. Make sure that you don't cover these holes because they do need to stay open to air to activate. And you're going to leave that patch on for 20 to 30 minutes prior to giving your shot. Once 20 to 30 minutes is done, you pull it off. You place your one-time use patch right on the cover. And you'll notice that it feels warm because once it's pulled off, that warmth activates it. And then you're ready to give your shot in that exact spot where you had your patch. And you probably won't even feel it. That's all there is to it. All right. So any questions about the Senara Patch?
All right, yeah. So we got this first one that comes in on Facebook. Says, how loose do I need to leave my clothes over the patch for it to work? I'd rather not have it show, but I will leave it completely uncovered if I have to.
Oh yeah, you don't need to let it show. You can cover it up with your clothing. That's totally fine. Just a loose t-shirt or loose shirt over it, or even your pants. Just they're a little bit loose because you do want air to flow through those holes to activate the heat, the iron powder heat that gets that medication into the skin.
Perfect. All right. Thank you so much. Okay, so we get this actually every single time just because it's a patch and because of the nature of the product. So it's not surprising that people are kind of just trying to figure out how the dosing works. And so this question says, what is the danger of overdosing if I forget and leave the Senara patch on for too long? Should I be worried?
Yeah, that's a good question. They do say that they don't want you to have it on for longer than 30 minutes. However, the company has done testing where they've put up to 4 patches on and measured the medication, at levels, and it has not been into the danger zone at all. So it's very, very safe. Even if you have 4 patches on and you leave them on for 60 minutes, twice as long as what's recommended, you still don't even come close to any kind of a dangerous level. However, just to be cognizant that 30 minutes is what they recommend, so take it off after 30 minutes. If you experience systemic side effects, which would be when the tetracaine and lidocaine gets into the bloodstream, you would have things like dizziness, lightheadedness, maybe blurred vision. If anything like that happens, of course, you would want to take that patch off right away, okay? And those symptoms should go away very quickly. But yeah, you can leave it on. If you left it on an extra half an hour, the likelihood of anything detrimental or having side effects is extremely, extremely low.
Great. And we also, it's interesting, while this was questioned, this may have just been predicated on the original hearing the first question, because a follow-up comes in that says, I'm actually worried if I may forget to put it on in time. Will it work if I only leave it on for 5 to 10 minutes before the shot, or should I just delay my shot and keep it on for the full 30 minutes?
Well, I would delay your shot for at least the 20 minutes. Unless, of course, it's a trigger shot. And we're going to be talking about the importance of timing with trigger shots next. But please do take your trigger shot on time. But if it's anything else, you can wait the 20 minutes and then just delay your shot a few minutes. That's fine.
Great. Sounds good. So I think people feel pretty comfortable now on how that one works as of right now. We are all caught up on questions regarding Senara or even Manipur. So why don't we'll give people another 30 seconds to a minute in case you're thinking of any questions or any follow-up questions from what you've heard already. And in the meantime, I will kick it back over to you, Laurel, if there's anything else you wanted to share while we give people a minute.
Yeah, there's a couple of side effects that you might experience that are not anything to worry about, but you could see some redness at the skin. You could see your skin getting a little pale or a little bit of swelling at the site where the patch was when you take it off. This isn't something to be concerned about. It will go away very quickly, but it is a pretty common side effect. And then I didn't mention in the video, once you take the patch off, you do want to do a little alcohol wipe on the site before you give your injection.
Great. Perfect. Thank you. And so it seems like we're caught up right now for Senara. So again, don't rush. If you have any questions or if you think of anything after the fact, we will have time at the end to recap on everything. You can type all those questions into either Q&A or the chat on your Zoom. And you can also go in via Facebook and just type it right into the chat, and we will get to that as well. But in the meantime, we can move on to the next product and get ready and then answer these questions if they come up. So not a problem.
All right.
Back to you, Laurel, to move us on.
Okay. So the next product is Avodro. It is a pre-filled syringe, really easy to give. This is what's commonly referred to as the trigger shot. And it's super important to give this at the exact time that your clinic tells you to. So if you're ready to show the next video, Craig, you can start Ava Drill. Hi, my name is Laurel, and today I'm going to show you how to inject the Ava Drill sugar shot. The Avodro sugar shot is used to stimulate the final maturation of the eggs in preparation for the egg retrieval. What happens is you give this shot approximately 36 hours prior to the egg retrieval, and it will stimulate the eggs to loosen from the inner follicle wall so your egg retrieval can be successful. Please make sure that you take this shot at the exact time that your clinic tells you to. So to give this shot, you're going to take it out of the box. It comes in a pre-filled syringe, so it's super simple. You just point it toward the ceiling, give it a few flicks, take off the top, and then you want to get rid of that air that's at the top. So you're going to push on the plunger, and you're going to get rid of the air until you see a little drip of liquid at the tip, like that. Now to give the shot, you want to pick a spot in your abdomen, and you can pick any spot you'd like as long as it's at least an inch away from the belly button and there's some fatty tissue to squeeze. So this is going to be my abdomen for the demonstration, and what I'm going to do is just give it a good pinch and hold it at a 90-degree angle. I'm going to go in quickly like a dart, let go of the pinch, and then I'm going to inject the medication. Once the medication is completely given, you want to wait about 3 seconds. Take a Kleenex, pull out quickly, and hold your skin with the Kleenex. After about 10 or 15 seconds, you'll check your skin. If it's dry and not bleeding, you're done. If you do see some liquid, or if it's bleeding, you're going to hold it a little bit longer. Recheck it. It's dry, then you're all done. Now to get rid of this, you're just going to drop it straight into your sharps container without recapping. And that's all there is to it. All right. Any questions about Avodro?
Yeah, so you had mentioned something about the bubble and how to get rid of that, but a question comes in that says, should I be worried if I see a bubble in my vial of Avodro? Can it cause any problems or danger to me?
Yes. We all have watched television shows that show bubbles being very dangerous. Little bubbles on the side wall of the injection of the syringe are not a problem at all. You can completely ignore them. What you want to do is get rid of the majority of air that's at the top of the syringe by pointing it at the ceiling and then just pushing on the plunger until you see that little drip of liquid. If for some reason you forgot that step and you gave it all with some air in it, it's not going to harm you in any way. It's not going to harm you. It's probably going to sting more because the air is going to sting. But there's no danger to putting a little bit of air into the subcutaneous fat. So don't worry about bubbles.
Perfect. So don't take any of your medical advice from movies and from daytime soap operas is what we learned tonight, which is very helpful. Thank you very much, Laurel. So how long, this question comes in, it says, how long does it take to ovulate after I take my Avodro?
Okay, good question. So Avodro is, it usually takes about 38 to 40 hours after taking Avodro to ovulate. So this is why your clinic will most likely tell you to take it 36 hours prior to your egg retrieval, because we don't want you to ovulate before your egg retrieval. If you're taking this prior to an intrauterine insemination, then maybe they're going to tell you 38 to 40 hours prior, or you'll have a larger range of when you can take this medication. But if you are taking it prior to an egg retrieval, make sure you take it at the exact time that you're told. If you take it too soon, there's a chance that at the egg retrieval, your eggs have already ovulated. Too much time has passed. If you take it too late, not enough time has passed, and your eggs could still be stuck on the inner follicle wall, and the egg retrieval is not successful. So it's very important. I don't know, I can't repeat it enough probably to take it at the time that your clinic tells you, give or take 5 minutes on either side of that time. My recommendation would be to set your cell phone alarm for about 10 minutes prior to needing to take it, so you get it all ready and you're ready to go.
Perfect. So actually, it's amazing that you kind of covered a lot in that, because a couple questions did come up, literally exactly how you just answered. How exact is the prescribed time for injecting Avodro, which you just covered within that, that 5 minutes? Because a lot of people are wondering, is it like, hey, do we mean like within half an hour that's good, or do we mean like on the dot by the minute? And so we like to know exactly, that just mark that time down and make sure you follow it. Which also means then, so a bit of a follow-up question. The question comes in on Facebook that says, what happens if I miss the timing of the trigger shot to inject? What are my options at that point?
Okay, so if you miss your time, you want to give it as soon as you remember. And then you want to make a call to your clinic to let them know the exact time that you took it. If you're preparing for an egg retrieval, there's a chance that they're going to move your egg retrieval time to correspond with when you did take it. Or they may not. It just depends on how much time has the difference between when they told you to take it and when you actually did. The main thing is just to have that open communication with the clinic. Let them know as soon as you made that error that you did, so they can adjust if needed.
Perfect. Thank you so much. Yeah, I think that is something that people get a little bit nervous about, just because when you hear that, and if you haven't gone through it yet and you hear about the idea of there being this exact time, like, oh God, what if I forget or I miss it or whatever, and it's a little bit different once you're in the process, as opposed to kind of looking at it from the outside in. Once you're in the process and you understand everything that's at stake, there's a lot more chance that you will remember, and that you will set those alarms for yourself, and that you will kind of put yourself in a position to not forget and to not make that mistake. But it's also good to know what to do just in case it does happen, right? Because we are all human. And so it's great to ask that question and to really find out how to kind of what's your safety net in these situations. And sometimes you may have, you might get lucky enough to have a situation that it does work out. So thank you so much for answering that, Laurel. And you did kind of touch on this pretty much, but we might as well answer it because it came in a couple times, and we get this almost every single time we talk about Avodro. Why exactly do we call it the trigger shot? Where did that come from?
Okay, so it triggers the process. It starts the process of the final maturation of the eggs. So if you can imagine these microscopic eggs, they're stuck on the inner follicle wall. It's a fluid-filled sac that is about the size of a grape, and these are clustered all over your ovaries. And that trigger shot is going to loosen the egg from the inner follicle wall, so it's free-floating in the follicular fluid. That way, when at egg retrieval, you're asleep, the needle goes in, you have little puncture wounds at the top of the vaginal vault on each side of the cervix, and each follicle is drained of that fluid. The fluid travels down a tubing into a test tube, and the eggs travel along with that fluid and can be collected. So that's why it's important to give it at the time they tell you, of course, and that's why it's called the trigger shot. It's trigger shot because it starts that process of maturing the egg and loosening it from the inner follicle wall.
Great. Thank you so much. And as of right now, it seems like we have all caught up on our Avodro questions coming in both on Facebook and Zoom. Again, just want to open it up. If people have any questions about whether it's any one of the three, Manipur, Senara, Avodro, any kind of any bigger scope questions that you may have while you have Laurel here, and see if she can provide some answers. So feel free. But in the meantime, we'll just give people another 30 seconds if they have any last questions. And I will, give it back over to you, Laurel, if there's any last, anything else you want to share with anybody before we get to the final closing.
Sure, yeah. I think it's important to know what the side effects are of Manipur. I'm sorry, of the Ava Drill. And this particular shot, it's not going to sting a lot, but there could be a little bit of stinging at the site, a little bit of redness. And I would say that redness and stinging should go away within about 10 minutes. And you can use the Senara Patch, or you can use Emla cream or ice the site prior to decrease that effect of the stinging. I think that's about it.
All right, sounds good. So yeah, we are pretty much all wrapped up. All the questions are in and have been answered. So I will give it back over to you to begin to close it down tonight and say goodnight to everybody.
Okay. So I just want to thank everyone for being here, taking your time. I want you to remember that you're going to take this one step at a time, and one day at a time, and just keep the faith that you are going to have success in this process. And I hope that tonight I was able to give you knowledge and confidence to enable you to give your shot successfully.
Thank you so much. I want to thank you, Laurel, for your time and your expertise tonight. You did, as always, an amazing job, and you were able to share a lot of your personal story along with answer a lot of great questions from all of you out there. It was a really great conversation back and forth, and I want to thank everyone who joined us via Zoom and Facebook Live for sharing your questions, your personal stories, and we definitely hope that you were able to learn something from us tonight, as we always learn something when we hear your questions. We get to learn a little bit about what are the questions out there that we can really help and put you at ease so that you do feel confident and ready to go when you give that first shot, reminding yourself what that end game process is. We'll always say, don't forget that all of these full virtual learning experience videos, or VLEs, as well as the individual product demonstration videos that we showed throughout, are available on demand at our YouTube page, on our Facebook page, and also, as Laurel mentioned earlier, at our homepage is mymandelsPharmacy.com/pharmacist. We look forward to seeing you all here again next Monday night and every Monday night thereafter at 7 p.m. EST for another great program. Please, we always ask, just like anything on the internet, the best way to get the word out is for you to share it with your friends and family. So please share this PharmAssist program with anyone that you feel can benefit from it. This is a great thing. We also recommend that because they're all available for you to go back and listen to on demand, if you are watching this in preparation beforehand, then you want to go back and revisit some of these videos right at the time where you're about to give the shot. It's great to queue it up, sit down with your partner or somebody else who can assist you, and really just kind of walk through it so that you're ready to go, and make sure that you feel confident and you are that pro that Laurel said that you will be at the end of all this. And please feel free to share that with everyone else so that they can benefit as well. And with that being said, I'd love to thank everyone again for their time and wish you a very good night. Thanks again, Laurel, and thank you to everybody out there.
Thanks, and good luck, everyone. Bye.
Bye-bye.